Well, ladies and gentlemen, hold on to your seats. Anybody in this room watch Fox News, Fox Television, you know the next... You know her as a judge. I know her now as a friend and a supporter of law enforcement. But at this time, you're going to hear it without the bark and maybe a lot of bite. We got a lot of problems in this country, and you just heard about the first and foremost one. Perhaps we use the word crisis. It may be even overused. I don't believe it is. Judge Pirro will moderate a panel on the opioid crisis sweeping our country. Please welcome on stage Sheriff Keith Cain from Daviess County, Kentucky, Deputy Michael Duane Harper from Daviess County Sheriff's Office, and Dr. Gail Cawkwell, Vice President and Chief Medical Officer with Purdue Pharma. Ladies and gentlemen, give them a round of applause and have fun.
Go up there. Hi. Hi. Good morning. I couldn't wait to get up here and talk to you. Did you hear about the travel ban and the Supreme Court? Reinstated. So there you have it. Good day in America. Anyway, as you know, I'm Jeanine Pirro. I'm thrilled to be here. I'm part of a 30-minute panel, and we've got some of the experts up here. And I just want to mention, before I get to the questions, what the issue is, although you could tell me what the issue is at this point. It started as kind of a whisper. I was an assistant DA and then the sitting district attorney. But what was a whisper in terms of drugs and drug overdoses is now a roar. And as the Deputy Attorney General indicated, it is an epidemic where 1,000 Americans a week are dying. Now here's the problem. There are those of you who can say, you know, my job is to make arrests and to fight crime, but the truth is, your job is also to protect the victims of drug overdose. And that's what we're here to talk about. The drugs today, as opposed to the drugs that I was used to prosecuting, are laced with fentanyl. Some of this stuff called carfentanil is 10,000 times stronger than morphine. 10,000 times stronger. And so what we've got to do is make sure that we recognize that there are efforts that we can do in addition to simply making arrests. I had a HIDTA Intel Center in the early 90s in my office. We joined together with state, federal, and local law enforcement, with stakeholders from every agency working in my office. But right now, federal dollars are not what they used to be. And so we are now pursuing partnerships with NGOs and the private sector. That's what I'm going to talk about now, and we're going to talk to you about our experience with Sheriff Cain, Colonel Harper, and Dr. Gail Cawkwell. She's a doctor because she's a PhD and an MD. Anyway, I'm going to start with the sheriff. So, Sheriff, we've been fighting drugs and drug crimes, the war on drugs, since I can remember as a young prosecutor. Yes, ma'am. Have we lost it?
Judge, it frustrates me, it angers me when I hear individuals, sometimes even my own peers, say that we have lost the war on drugs. We've all heard that. The reality is that we haven't lost the war on drugs because that's indicative that the war is over. The war rages on. Have we lost a few battles along the way? Absolutely. But I would also remind you that we've won a lot of those battles too. That's documented in the people that we saved, the lives that we've changed. The war on drugs is very much still active. To indicate that it's over is indicative that we have given up, and that's something that law enforcement can and will never do.
Yeah, but the problem is with 1,000 people a week dying, and there is, you know, the spectrum is across the board. There's no socioeconomic or ethnic delineation. It's all of us. Why is it so much higher? Why is it an epidemic now?
I don't think there's any real easy answer to that. There's certainly no simplistic solutions to that very, very complex problem. The availability of the drug is such that it drives the addiction of the drug and all the negativisms associated with that. This is not, very much not just a law enforcement phenomenon. This is a societal problem. So there has to be a collaborative and a collective effort between law enforcement and the private sector to combat this problem for it to be successful.
And in terms of combating it, it's not just about making arrests, but what do we do for the kids or people across the board who've overdosed? What have you found to be one of the most effective remedies?
That's what we're here to talk about today, the use of the drug naloxone. This is a drug that reverses the effects of the overdose. It saves lives, and that's what we in law enforcement do. That's what we're in the business to do. That's the benchmark of our profession, to save lives. Sure, I've been a law enforcement officer for 44 years. I've kicked my share of doors, locked my share of people up. But this is about saving lives, not only the lives of people that are overdosing on the drugs, that's important, but also our officers that are coming in contact with these deadly drugs. And what about the child found in that home that gets into the mom or dad's stash? These are the realities that these officers confront daily, and we need this drug to be successful in saving those lives.
All right. Now, when you talk about Narcan, I mean, one of the people who are helping out with Narcan and providing the money for the pilot project in 2015 in your county and
That's
several
correct.
others is Purdue Pharma. Now, Dr. Cawkwell, the truth is that the elephant in the room right now is that there are people saying, wait a minute, aren't you part of the problem? Didn't you create this epidemic?
Look, I think prescription opioids and things like heroin, fentanyl, carfentanil are very complicated societal problems. Purdue Pharma does manufacture and commercialize several opioid pain medicines, but they are prescribed. Doctors need a DEA license. They need the training of medical school to be able to prescribe them. It's our job at Purdue, and my job particularly as chief medical officer, to assure that we're setting standards so that doctors are only writing the drugs for patients who really need them. We all know people who've had cancer, major surgery, or other problems, and they do need opioid analgesics. Now, I think there's more opioid analgesics out there than there needs to be. And I would encourage all of you, if you have a minor procedure and your doctor gives you 320 Percocets, ask, do I really need this many? And if you take them home and you take 2 for your severe pain, look for a good drug take-back program. Don't keep them in your house. So however things got started, we're in a situation now that really requires action, and it requires action on the part of all of us.
And you are taking the action. There is a rescue drug, this Narcan.
Right.
Tell us what you have done in terms of Narcan and what the impact is on the individual to whom it's administered.
Well, I have to start by saying we've only done a very little bit. It's these fellows and you all
Yeah,
out
I'm gonna
here
get to him in a
who've
minute.
really done
Yeah.
the big stuff. So what we did is we recognize that people overdose and they need a chance to get into rehab. They need a chance to get their lives back. And they may not take that chance the first time they get a shot. It might seem frustrating, but at some point they need that chance to get their life back and take care of their families and be good community citizens. So what we did is we, about 18 months ago, provided a grant to the National Sheriff's Association for $350,000 for training and for Narcan kits to be used in communities. And we were so impressed by the response and the impact that you all have had. Over 120 lives saved to date. And so we've gone ahead and funded an additional $500,000 to expand that effort.
All right, and I want to go right to Corporal Duane Harper. You have been on the front lines. You've been involved in rescuing individuals who would have overdosed. Give us a sense of, how you assess whether or not someone needs Narcan and how long it took for you to train and implement the strategy.
Okay. Particularly, you need to, know if that person is first of all, if they're not just extremely high, that to assure that they've overdosed. Once you've assured that it's an overdose, then you want to go ahead and monitor them.
How do you figure that out?
Well, you stimulant. You can do a sternum rub. You can do pinch the earlobe or something like that and see if you get any response out of them. If you don't get any response out of them, you go and you check. You'll see things like the clammy skin, pale skin, the pinpoint eyes, and all that. And then once you get to that point, to where you've determined that it is an overdose, and you want to go ahead and administer the naloxone. And once you've administered the naloxone, just monitor them, make sure you check their ABCs, always make sure they're still breathing, because what it does is depress it, and it affects the central nervous system, which slows down your breathing and your heart rate. And once you administer that naloxone, it's reversing that effect.
All right. Do you have the Narcan?
Yes, I have.
I just want the audience to see it. I was stunned. It's a very, very small applicator.
The kit comes with a set of latex gloves, the Narcan kit itself, a face shield if you have to go back to your CPR and rescue breathing, if that person loses, consciousness to where they stop breathing and all that. The kit comes with the nasal applicator. Once you remove.
Where's the little white thing?
This is the nasal. This is the part that screws on for the nasal.
Okay.
You take off. You remove the yellow cap. You screw on the nasal. You pop off the other yellow cap. You remove the cap from the Narcan itself. Inject it into the. You put it into the. Well, if we can get it in here. Oh. There you go. Once you get it in there, then on here it's got a mark of a halfway mark, so you'll know that you're spraying half of that up one nostril.
So it's a spray.
Yes, it's a nostril. It comes both intravenously. You can inject it into the muscle, or you can nasal.
Sheriff, I'm going to go to you.
Sure.
You made the decision to require that all of your officers are equipped with the Narcan.
That's correct.
All right. And how difficult was that? How long did the training take? And if you didn't get the money from Pharma to do this, would you have been able to do it? Purdue, I should say.
It was a conscious decision after a considerable amount of research. I was, as many of my peers were, reluctant initially. Number one, it was originally only available in the intravenous form. For obvious reasons, we were reluctant to introduce needles onto the front line with all these officers. But that was taken care of by Purdue by utilizing the nasal applicator. But there were still concerns. What is the liability attached to one of my officers utilizing this and something were to happen with this individual? Our state legislature and many other legislatures have addressed that issue so that there is no liability for our officers. Another big concern was my officers aren't medical technicians. They're not doctors. Mistakes can be made. So what happens if one of my officers administers Narcan to an individual that is not suffering an opioid overdose? It's been determined that there are no negative side effects.
There are no negative side effects. So if you gave me that right now, nothing would happen.
That's correct. So all of these were factors that we took into consideration. And ultimately, we saw there was virtually no negatives. And the positive was that we were going to save lives, and we have saved lives. I've often been asked by my peers, why would you do this? When the question really ought to be, why would you not do it?
So, he's talking about me. So why don't you give us an example, Corporal, as to an individual that you came upon and some of the positive results you've had.
Okay. Back in May of last year, 2016, I was dispatched to a call in rural Daviess County. It's probably about as far out in the county you can get. You go in the front door, you're in Daviess County. You go out the back door, you're in another county. So what it was, this lady, she'd had some personal issues, some psychological, mental issues. Her son was down in Bowling Green at West Kentucky University. He kept calling his mother, and she never responded to his phone calls. She was in her 50s, so he calls his grandparents who live close by, and they're pretty much, 70s to mid-70s. They get there, They don't see what we see when we get there. You know, we see the evidence of things laying around. They get there and they try to wake her up, and she tells me they put cold rags around her on her head and all that. By that time, you know, the son had made the decision, you all need to go ahead and call 911. Once I get there, it was determined, once the evidence I saw, that, you know, this was an overdose. I asked the grandfather to go outside because protocol is for our fire and EMS to stage up somewhere until, you know, deputies or law enforcement's on scene. So once I got grandfather outside, I had grandmother go around trying to get some identification for the EMS and all that. And while I was in there by myself, you know, I went ahead and administered the naloxone, watched her, you know, she's still breathing. After 3 or 4 minutes, I administered the second dose. About that time, she come around. It was kind of like she was biting on a lemon, a sour lemon. She started coming around. Now, sometimes they say they might come around agitated.
Right.
The twice I used it, they've been more confused, like waking up, why is this deputy standing over me, and all that. But since then, I have gone out there and paid her a visit, drove up. She was weed eating her ditch is when I saw her. She's still having issues, but she is talking to somebody.
How long did the training take, Sheriff?
It's administered, it's a day-long training.
All right, and Doctor, does Purdue do the training? Who does the training?
No, we don't do the training. We supply the funds. We know it's going to go to a good effort, and it obviously has. You know, one quick, so it's done independently. But one thing I did want to add is I wanted to just reemphasize, more as the doctor and less as the Purdue doctor, that even in medical school, going back a long time when I trained, you were really trained, if you were uncertain, give Narcan. If somebody comes in, you don't know if it's an overdose, you can't do much harm, and people will wake up when you give them Narcan if that's the issue. So I just really applaud the efforts. You don't have to be a doctor, you don't have to make a diagnosis, you just have to have the suspicion, and the person should be unconscious. And it's so impressive, the work in the stories.
So who does the training, Sheriff?
It's supplied by that's part of the partnership with the National Sheriff's Association.
Aha, all right. So if there are sheriffs out there who want to be a part of this program, how do they do that?
Absolutely. They contact Fred Wilson here at the National Sheriff's Association, and that would start the process.
All right. And can I just ask for a show of hands, how many of you have had an individual die of an overdose in your presence or in one of your officers' presence? Yeah, lots. So what do you say to the people who are here? How would we get enough money to be able to give them the Narcan if they feel that that's something they want to do?
That's the value of the partnership, Judge. You know, we all live in the reality of shrinking budgets and budgetary restraints. And the tragedy lies in those that don't have the budget and the funds to obtain this medicine. And so people die as a result of that. This partnership provides this medication to those agencies at no charge. The training is at no charge. There is absolutely no negatives associated with this whatsoever, unless you consider, and I've heard that, I mean, let's be honest with each other. I've heard about the issues of partnerships with Big Pharma and all these issues, okay? But the reality is that this problem is huge. And it's large enough that there's room for help from everybody. And it has to be a collaborative, cooperative effort. The money from federal government is no longer there. The grants are gone. That's a thing of the past. We have to look for other avenues and resources. The most important job that myself or any other sheriff here has in terms of our officers and the people that we serve is to provide them the resources, the training, the knowledge they need to do their job, do it effectively, and do it safely. This program does that.
And you have no hesitation, no reservation about people in your office, every one of them having the ability to administer and assess whether or not this should be administered.
I wouldn't be sitting on this stage with you today, Judge, if I had that reservation.
Why does that not surprise me? And let me ask you about, I'm going to go to you again, Doctor. When you created this rescue drug, as it's called, was there any requirement that you actually assist law enforcement by providing law enforcement with this? Because Purdue is not the only company that makes things like oxycodone or anything with an oxy in front of it.
Right. So first I'll start by saying that naloxone has been around for a long time. It wasn't developed by Purdue. We don't manufacture or distribute any of the formulations. So our grant is there for the training and for the purchasing of kits through other sources. And it's again seeing the impact. That's what we like to fund, organizations that have the impact and save the lives. For us, though, there wasn't a requirement to do it. We just look at the situation going on in the world, in the US today, and it's important that we make a difference. Opioid as pain medicines do play a role. Everybody knows somebody who's been in this situation where they've had surgery, they've been shot, they've had cancer, and they need an opioid pain reliever. Not everybody does. Doctors need appropriate training. Everybody needs to do it the right way, but there's no requirement here. We need to make sure the medicines are available for the patients who need them, but that the systems are in place so that they are not abused, and that for the people who do have the very complicated addiction problems, that they get the help they need, and that often starts with treating an overdose.
And Sheriff, I'm going to ask you this. With President Trump now and, the border and immigration and a lot of the drugs, or the number of people coming across the border has been reduced by something like 70% in this short few months. The supply is going to go down, demand is going to go up, prices are going to go up. So the addicted person is now in a going to, I assume, commit crime. And so crime is going to start spiking to accommodate those who need to support their habit.
Absolutely. In fact, Judge, I chair the Drug Enforcement Committee for the National Sheriff's Association. We met just yesterday with officials from Border Patrol and Immigration, and we heard those stats of how those numbers are going down since the change in the administration. That is a reality. It's good news. But the bad news that follows that is just what you've indicated. As we cut off the supply, the demand goes up, the prices rise, and crime rises expeditiously with that. We in law enforcement have been doing this for a long time. We're very adept at what we do, catching the bad guys. But this war is only beginning. That's why we can't buy into this, is that we've lost it. Our jobs are only just beginning. But law enforcement is up to that task.
Law enforcement is up to the task of, using the rescue drug and making sure that we get the word out that it's available and that any sheriff who wants it can get it. But then the question is, how do we fight drugs and drug crime differently than we've done since the Nixon administration?
I don't know that I can tell you that what we do differently, other than to tell you that that we aggressively continue to do what we have done. I can tell you in Kentucky that we've expanded the availability of centers that address these issues of addiction. We in law enforcement have partnered with our legislature in terms of more aggressive penalties for those individuals that would traffic in these drugs. Law enforcement themselves are aggressive in our effort. We get it. We understand 80+% of all the criminal activity in our communities is tied to this very issue, and we're dedicated in our combating of that.
Corporal Harper, let me ask you, if you were to tell this audience one thing in terms of your experience, what would you tell them?
These are law enforcement officers out here. They carry a gun, a taser, an asp. They're carrying that to protect themselves and protect others. Carrying this saves lives. Carrying this saves lives. And just like the last gentleman said, talking about officers being exposed to certain things, I carry one in my sock just for that reason.
Let's talk about that for a minute. How potent some of this fentanyl is. That if an officer is executing a search warrant and opens a drawer or becomes exposed to some of this, why don't you explain how Narcan can assist them and their fellow officers in protecting themselves.
Well, if if you have that, readily available, you can, administer it to that officer at that time.
How about canines?
Now, that is something that, we've had our canine officer bring up that, yes, he is looking for ways to.
Has Purdue done anything for the dogs?
There are canine Narcan kits out there, but it's a good question. I hadn't thought about that up to now. It's a good question.
Mm-hmm. I'm a dog lover. What do you want to add, Sheriff? What do you think?
I can't really add anything, Judge, other than, the fact that we're here and we're talking about it, the dialogue that we've talked about, but those are all just words. These officers in this auditorium and those others that they represented, they're devoted, they're dedicated to this. They do it every day. What we talk about from a lectern or a podium, they live every single day. And, I think I would be remiss too if we didn't give thanks where thanks is due. And this administration that has just taken office, President Trump and his administration, we know that we have the backing of the administration. And quite frankly and very candidly, that's something that we've been lacking in years past. And don't think that that word doesn't go forth to these men and women in law enforcement. And that gives us hope. And it motivates us to do that which we're called to do, and that is indeed to protect and to serve.
Let me just say that in closing, is there anything you'd like to say, Doctor, in closing?
I'll just reiterate that I want to start by we gave the money, but that's the easy part. I just want to thank all of you and your offices for doing what you're doing and for saving the lives. And that's my point.
All right, Corporal?
Just the pilot program that we used, it just shows that it does save lives. That's one life saved, one less statistic.
All right, and let me just say that as the Deputy Attorney General indicated, this is a clear and present danger. This is something that all of us have a stake in resolving. And it's no longer, social services or mental health or, a medical issue. It is an issue that you are going to be on the front lines of. And you know what? You were the first responders. You were the ones who are in a position to change lives and to protect the rest of us. And so let me just say, in the words of my good friend Vernon Gebreth, who wrote a textbook on homicide investigations, you do God's work. And as the sheriff indicated, there is an administration that is behind you. And for those of you who just hear the negative stuff that we hear every day coming out of the news on the East Coast and the West Coast, the truth is that America is with you. America supports you. We believe in you. And we thank you for what you do day in and day out. And on a personal note, you're in the best business out there. It was the best job in the world. Thanks so much for being here. Thank you, Sheriff, Corporal, and Doctor.
Gail, thank you. Deputy, thank you.
Thank you.
Sheriff, thank you. Jeanine, would you join me at the podium, please, briefly? Thank you for your insights. Wow, she gives it to you exactly. It's amazing stuff. I have a little gift for you. It's something we don't usually give out. In fact, we've just started giving it out. There's two gifts, actually. This first one we give to special presenters, which I think you'll like it.
Oh, that's beautiful.
Yeah.
Thank you. Thank you so much.
But we've just started recently doing something when people give the National Sheriff's Association more than $10,000 in donations. We've created a special pin. It's a sterling silver pin with a sapphire in it. It's the very first one we've given out, and your time and your advocacy is worth far more than $10,000 or any level of money we could ever give. I hope you'll cherish this. It's important to us. Congratulations.
Thank you. Thank you so much. Thank you. It's beautiful. Thank you. Thank you.